This is a video for men looking for a scientifically proven exercise routine to improve their erections, and it may also help reduce how often you wake up at night needing to pee. Hi, I'm Daniel, physiotherapist and licensed healthcare professional. I've designed this video in 3 parts. Each section is important, so make sure you watch them all. If you haven't got time to watch them all right now, then subscribe, save the video and make sure you return to them later. A lot more men suffer from erectile dysfunction than you may realise. For some it's an occasional problem, and for others it's more of a persistent issue. Research shows that up to 20% of men may experience erectile dysfunction, and even this figure may be underreported. So in this next clip, I'm going to explain how erections work. Think about when your blood pressure was last checked. As the cuff inflated, your arm got tight and stiff, then relaxed once the cuff was released. That's not too different from how erections work. Blood flows into the penis and is held there largely thanks to 2 key muscles, the ischiocavernosus and the bulbocavernosus. These act like a natural blood pressure cuff. Those muscles I've just mentioned are part of your pelvic floor, a sling of muscle at the base of your pelvis. And they're what we're going to strengthen today using science-backed physiotherapy techniques. Sit somewhere quiet and you'll need a timer. Your phone could work just fine. Now we're going to start here with some awareness exercises to make us aware of those deeper pelvic floor muscles that we need to strengthen. To help identify the right muscles, imagine you're in the queue for the toilet and you need to stop yourself from peeing. You'll probably feel a slight lifting of the penis and a raising of the testicles. These are your pelvic floor muscles in action. Next, try contracting the muscles at the back of your pelvis. Imagine you're having to stop yourself from passing wind. Now do both at the same time. Imagine you're in the queue for the loo, contracting the muscles at the front of your pelvic floor, and imagine having to stop yourself from passing wind, contracting the muscles at the back of your pelvic floor. By doing both, you should feel a gentle lift up through your pelvis. So now you know how to contract your pelvic floor muscles. I'll give you 2 exercises that you can do to get stronger. But before we move on, a couple of extra tips for you. Don't hold your breath, that's not necessary. And also clenching your buttocks is not activating your pelvic floor. So relax your buttocks and don't hold your breath. This first exercise routine is all about strength, and it's called the quick contraction routine. So contract the pelvic floor muscles, front and back. We've just gone through how to do that, and hold that for 2 seconds. Then relax for 4 seconds and repeat this 10 times. I'll put this routine on the screen here for you because you may wish to pause the video and have a go at this before we move on. Next we have the endurance routine, which will help you with lasting longer. Here we want to contract the pelvic floor muscles, but only this time with a 50% effort, so not a full contraction. Hold that 50% effort for up to 30 seconds. Then relax for 1 minute and repeat this 3 to 4 times. Again, you may wish to pause the video and try this before we move on. You don't have to do both of these routines together. You could do the quick routines in the morning and perhaps do the endurance routines in the evening. Before we move on, here's some top tips for you. Plan your sessions, set aside some time in a quiet space. Don't overdo it. Pelvic floor muscles also need time to rest and recover. Use relevant positions. Practicing in bed or a lying position may be more effective. And avoid irrelevant exercises. Bridging or lots of glute work won't target your pelvic floor and might actually increase tension. And that's because pelvic floor tension can actually cause problems like erectile dysfunction and frequent urination. Common causes of tight pelvic floor muscles include ignoring the urge to go to the toilet, IBS or gut discomfort, chronic stress and anxiety, overtraining the core, and constantly holding your stomach in. So as we've been talking about tension, I now want to show you a great stretch that you can do to reduce that pelvic floor tension. So this is the stretch I recommend you do. It's known as the happy baby stretch. Lie on your back with your feet on the wall and try to get your bum as close to the wall as possible so you've got a good bit of flexion through your hips. Have your legs nice and wide apart and relax your breathing. Breathing in through your nose and out through pursed lips. If you can, use your hands to pull your knees back further over the sides of your abdomen, pulling your feet slightly away from the wall. Remember, this is a relaxation stretch, so if it feels painful, stop, and if you feel too much tension, stop and release the stretch. Breathing in through your nose and out through pursed lips. Because you're trying to relax and stretch, don't rush this routine. Take at least a minute, if you can, more like 5 to 10 minutes, just relaxing in this position. See if you can open up your hips a little further and get a good stretch whilst you're doing this routine. If you find the stretch easy and you want to progress it, then take a hold of the outside of your feet and stretch from this position. Next, we'll talk about releasing pelvic floor muscle tension using a ball, a roller, or even a plastic water bottle. Before we move on, I would advise not using a large spiky massage ball like the one showing on the screen here to perform the techniques that I'm about to show you. So we'll start with the ball technique, and you'll probably want to come a little bit closer while I show you this one. So I'm going to use this firm foam massage ball, but you could also use a tennis ball, which is slightly larger and slightly softer. You want to sit on a soft to firm surface with your feet on the floor so you can take some weight through your legs, and also you're going to take some weight through your hands so that you don't have to put all of the weight and pressure down onto the ball. Next, sit the ball underneath your sit bone, that's your ischial tuberosity. I'll show you a picture of that on the screen here, also known as your bum bone, and sit on the ball in this position. Then roll back so the ball rolls slightly forwards and in, and then allow the ball to sink in as you put some extra weight down through it by releasing the pressure with your arms and letting your legs relax a little bit more. If you feel any pain, then stop immediately. Otherwise, gently move back so that the ball rolls forwards, and then gently move forwards so that the ball rolls back. When you're doing this self-massage routine with the ball, make sure you don't hold your breath and do your best to relax. And also, just in case you were wondering, you can also do this self-massage using a small diameter roller or a plastic water bottle. I'll do the demonstration using the water bottle. You can use a bottle with water in it, but of course I would advise using one without water in it for obvious reasons. Screw the lid on nice and tight so that the air is held inside. And then on one side, you choose which one you want to do first. Place it between the top of your thigh and side of your bottom, and then sit on it as if you're sitting on a saddle, but slightly to the side. And from this position, you can gently rock forwards and back to apply a self-massage through your pelvic floor muscles. Up to 30 seconds, and then switch sides. So we've been through strengthening, stretching, and releasing for your pelvic floor muscles to help you combat erectile dysfunction. If you found this video helpful, please give it a like and share it with anybody that you know who may find it useful. You've been watching the Physio channel. My name's Daniel. See you in the next video. Showing on the screen here is one of the studies that we used to put together this video. This study explored if pelvic floor exercises can help men with erectile dysfunction. Researchers found that men who did these exercises combined with biofeedback showed significant improvement in erectile function after just 3 months. In fact, 40% achieved normal function and another 34.5% saw improvement. This suggests that pelvic floor muscle exercises could be really effective as a first-line treatment for erectile dysfunction. And there are many other studies which also support this. If you'd like to know more about what biofeedback is and how they used it in the study, I'll put some more information in the video description for you.